So you know, when you hear that the government is not going to be involved in healthcare, I mean, look at this. Right down to trying to decide how much mental stress and effort is going to be involved in every service that's given to you. Doctors, number 11, doctors who provide services at specialty cancer centers may get paid less than doctors who provide care at regular hospitals, even though providing care at regular hospitals exposes these immune-suppressed individuals to all the diseases that walk through the door at a regular hospital. Number 12, there will be more higher payments for those who provide counseling on and directions for end-of-life decisions. The bill has specifics including what should be on this order, and I found it very interesting that it mentions things like the intensity of the medical intervention if the patient is pulseless, apneic, or has serious cardiac or pulmonary problems. Now, there's no terms. I mean, there's no definitions to that. What does that mean? When do you get into these serious pulmonary or serious cardiac problems? Who gets to decide what's serious when that starts? Number 13, there'll be a Center for Comparative Effectiveness Research to conduct surveillance through all of your electronic online medical records with respect to your outcomes, the effectiveness of your care. In other words, how well did it work on you, or how well did it work on you as according to what they thought was effective, and whether or not it was appropriate, all these services and procedures. They will use this to come out with what they call evidence-based medicine, where they will say this provides scientific rationale for denying access to certain services, which we have found by looking at all our data and all the patients in the country is not appropriate or effective, and therefore we will not pay for it. This center, number 14, this center will encourage the development and use of clinical patient registries, tracking systems, in other words, and clinical effectiveness research data networks to better tap into and track you and your doctors. Number 15, the center may secure personal data on you and your family, quote, from any department or agency in the United States. Number 16, you'll be taxed to pay for this center. A new comparative effectiveness research trust fund will be established, paid for through fees on private insurers. And of course, private insurers don't pay for anything that they don't collect from you, right? So this is a tax. Number 17, to hunt for fraud, waste, and abuse. And mind you, there are no definitions for fraud, waste, and abuse. And as Senator Cardin in his town hall meeting said, sometimes doctors get into trouble because they're trying to be really good with the patient to give them all that they want, and they're found to be, or they're considered to be fraudulent. In other words, they're defrauding the federal government by providing services that Medicare doesn't think the patient wants, should have, rather not wants. So, to hunt for fraud, waste, and abuse, these undefined terms, all your data can be made available to the U.S. Attorney General. And number 18, your insurance plan must provide preventive services even if you don't need or want them or want to pay for them. Now, a really important thing to understand about preventive services is a health insurance plan, true insurance, is for catastrophes. Requiring you to pay for preventive care means that you really can't have a true insurance policy. You really have to pay for prepaid health care rather than a true insurance policy that would help you to keep all of these third-party payers, including government, out of your business. Number 19, a public health fund to build the public health bureaucracy and train government bureaucrats how to run your life will be set up to the tune of $88 billion. And number 20, a prevention and wellness trust fund will be established for $30.8 billion, and that money will be used to monitor your health status, your wellness, your use of exercise equipment, your diets, etc., through various studies that they might come up with. So, how are you feeling? Sick, you need a doctor. Okay. Well, remember how the president said, if you like your health insurance, you can keep it. Well, yes, but only until the insurance company decides to raise your rate, or you add another person to the policy, or the company changes anything in the policy, or your health or your employer decides to drop you so that you can go into this Medicare for All public option. So you're safe unless anything changes, and then you're not. Then you'll have to go to the federal government's limited list of qualified insurers and pick from them, regardless of the cost to you, regardless of the coverage. President Obama also says the new Medicare for All public option will keep insurance companies honest. Well, it won't do any such thing, because only you with your own dollars in hand and the ability to come and go and choose something else will keep them honest. But here's a question that nobody's really been asking. Considering the president's willingness, I think, to be less than honest with you, the American public, who's going to keep the government honest? I watched the president's first healthcare town hall meeting in Portsmouth, New Hampshire yesterday. The audience was clearly stacked in his favor, but one moment, first of all, who saw it? Who watched it? Okay, I'll be interested to see if you thought like I did. One moment showed how far Mr. Obama has to go to convince the public about his plan. When the president said he was going to pay for the bill by eliminating waste from Medicare, there was a deafening silence. He paused. He waited. Somebody must have said something. He goes, "That's right." Somebody, we couldn't hear it anywhere, right? There was no applause. So clearly the public is worried, even those in his camp, even those who like the idea of universal coverage, even those who like the idea of never having to talk to an insurance company again, are worried about what's going to happen with Medicare. I also watched Senator Benjamin Cardin's town hall, and he admitted what few people are saying. In response to a question, which I don't remember, he said, Medicare cannot be fixed unless we fix our healthcare system. We have to bring down the total cost of healthcare in order to, and I missed those words, but the gist of it was in order to fix Medicare. He said we're not going to cut benefits under Medicare, we're going to expand them. Yes, okay, that was the end of his quote. My response is yes, but he's going to cut $500 billion out of Medicare. So where is that expansion of benefits going to come from? It's going to come from access, less of it, limited access. Here's what I want you to see. This debate is really all about Medicare. If we did not have Medicare today, we would not be even having this debate. American healthcare has been in trouble since single-payer proponents got Medicare enacted and the government offered doctors, hospitals, and senior citizens a free-for-all access to the United States Treasury. And they took it. Who wouldn't? There it was, free, right? But of course it wasn't free. And now we see how unfree it was. Single-payer, government-run healthcare proponents knew we'd end up right here someday. They knew that they could use Medicare to drive us into socialized medicine, or at least they would try really hard. And that was the whole idea. Get a whole group in, bring the rest. Medicare is the problem, but nobody wants to do what has to be done, which is to plan an exit strategy for Medicare. Someday, I would like to be able to say that I am not in Medicare. And I would like there to be a future where there is no Medicare for the people who are coming behind me and behind you. Medicare is about to become a death trap for millions and millions of seniors. Liberals want to get everyone's money in the same pot so that they can ration it under the radar and avoid the political fallout that's bound to come when Medicare goes broke in 2017, 8 years from now. Last year is the first year that the revenues coming into Medicare were less than the money going out. This is unsustainable. Everybody says that, and it's really, really true. But ration is also going to come in another way that Congress can't control, unless, of course, they completely eviscerate the Constitution. So imagine what will happen when doctors start jumping the Medicare shift or students refuse to become doctors.